लाइव ही है ना? लाइव ही है ना? चल रहा, चालू हो गया ना?
हाँ चालू है।
First I'll start. Ma'am, that ma'am joined.
Screen share எப்படி பண்ணணும் மேம்?
A very good afternoon to one and all present here. On behalf of the RRC unit, Guru Shri Shantivijai Jain College, I welcome one and all for this presentation, that is AIDS Awareness and Basic Gynecology Welfare by Dr. Kalaichelvi ma'am. Now our request Ms. Sonal Chopra of 3rd BBA to give the welcome address. Thank you.
We are sharing a PPT. Okay. Good afternoon. On behalf of GSS Jain College for Women, Secretary Sir, Principal Ma'am, and Dr. S. Kalaichelvi Ma'am, MD, Professor of Medicine, Government Stanley Medical College, Chennai. I request you to start with the session, ma'am. Okay. Thank you. Am I audible?
Yes, ma'am, you are audible.
Yeah.
Yes, ma'am, audible. Very much audible, ma'am.
Yeah. The respected Honorable Secretary, Dr. Gautam, Principal Dr. M.K. Malati ma'am, Faculty Coordinator Swarna, Student Coordinator Sonali Chopra,
and other students from Guru SHREE SHANTIVIJAI Jain College. Good afternoon, one and all. I am Dr. Kalai from Stanley Medical College. Here today I am going to talk about HIV and AIDS awareness, and also about a little bit about the basic gynecological welfare. Okay, so what is HIV? HIV, as you all know, it stands for human immunodeficiency virus. Actually, what happens with this virus? With this virus, when it enters into the 1 second. Yeah, when the virus infects or gets into the body, it causes a weakening of the immune system, so that the body's immune system goes off and a patient becomes sick. Actually, this is not happening in one day. Actually, what happened when the virus enters the body, it encounters a cell called CD plus cells. CD plus 4 cells are nothing but it is an army of our body. It is called army of our body, or white blood cells. One among the white blood cells is called TCD4 cells or T helper cells. Actually, what in an emergency situation at our home, what we do? Actually, we call 108. 108. When we call, they come and coordinate with us, and so that the situation can be tackled. Likewise, when a virus enters into the body, what does it have? What happens? When the virus enters into the body, the CD4 cells, otherwise called T helper cells, they act as 108 and call upon the other immune persons like neutrophils. There are so many persons in the white W blood count army. They call upon all the armies and they try to kill the enemy, that is the HIV virus. So this is what is happening in case of acute infection. This is an emergency situation. But what happens is this cells, this HIV virus, it goes into the WBC cells, and the fighting is going on and on for a longer period of time. So these CD4 cells are going on fighting, and it becomes exhausted and weakened, so that the immunity goes down. The body's immune system also, it is weakened. So this is a long process. Actually, 1 minute. Excuse me.
Yes, ma'am. Please tell me, ma'am.
Yeah. So what is the 1 minute? I'm 1 minute. I'm coming.
Okay, ma'am.
Okay, next is what is HIV? HIV is it is a retrovirus. It contains RNA as a genetic material. What we have is DNA as the genetic material. This HIV has got a RNA as a genetic material, but it gets into the normal cell. That is, normal cells is our CD cells. It attacks the immune system to conquer the host body completely. So second thing is AIDS. What is AIDS? It is developed in HIV infected people after 2 to 10 years of time. So the AIDS is, after patient becoming AIDS patient, they are prone to get multiple infections. So what is abbreviation? It is abbreviation for something. It is called acquired immunodeficiency syndrome. So what is syndrome? Is collection of symptoms that develop together. That is called a syndrome. So acquired means you have acquired the infection from the environment, and immunodeficiency means weakening of the immune system. Where the body is unable to defend even an ordinary infection like cold when the immune system is going down. For example, the patient develops a collection of symptoms together due to multiple infections like tuberculosis, fungal infections, and malignancies. Malignancies means cancers. So unusual cancers are used to affect these type of AIDS patient. AIDS patient is the patient who are having reduced weak immunity system. Okay, so Then what is the current scenario? Current scenario, actually, we are celebrating the December 1st as the World AIDS Day to spread the awareness among the people. And National AIDS Control Organization, that is called a NACO, which states about 7,000 people, new cases are identified in today in India. That is the current scenario. But uh, we have to from 1980 up till now, about 38 million people have died of AIDS, and about 38 million of people are living with AIDS or HIV infection with people living with HIV and AIDS. It's about 38 million people. So it is a HIV infection is a global pandemic. Pandemic means with the cases reported everywhere in the country or in the world. Every other country is reported of HIV infection. That is called a pandemic. And estimated about 95% of the people who are suffering from HIV are living in the low and middle income group of countries. And among the people who are living, 50%, more than 50% of the people are female patients. And about 2 million people are less than 15 years of old children. 2 million people are children. So the estimated number of people living with the HIV, that is global pandemic, has increased fourfold since the 1990. Why? Because more amount of infection as well as introduction of the antiretroviral therapy, which prolonged their life. So more the HIV infected people and the people living with AIDS has increased fourfold since 1990. But between 2000 and 2016, the estimated annual numbers has decreased. Actually, decreased by 40%. This reduction of global HIV infection is rightly reflected the progress of HIV prevention effort and increased promotion of the antiretroviral therapy, which made less likely to transfer the infection from among the sexual partners, as well as the availability of the drugs for the antiretroviral therapy for the mothers who are infected with HIV, which reduced the level of HIV infection 40%. So among the adults, the estimated incidence declined by 11% from 2010 to 2016, and there was 47% reduction in the HIV infection among children less than 15 years because of the availability of the drugs to their mothers. So the major chunk has reduced in among the children, that is about 45%. In 2016, the global AIDS deaths is totaled about 1 million deaths, which included about 12,000 children less than 15 years. But a 48% decrease in the death since 2005 that coincides with the access to the antiretroviral therapy. So the infection rate also has come down, the death rate also has come down since 2016. So since the beginning of the pandemic, it is about estimated about 38 million of people have died because of AIDS and AIDS-related condition. And of course, 38 million of people are living with the AIDS, and among them 20 million people are females and 2 million people are children. So really it's a bad scenario only. About the statistics, HIV statistics worldwide, mostly the which country, Eastern and the Southern African countries contains about 20 million people. Only the small area, 20 million people are living among the 38 million people. And next come the Asian and our China and our country comes because of the highest population and highest infectivity rate. We come the next year, next place. Then goes
Madam,
to the
one
third place
small
is
help,
the
ma'am.
East African countries. Is
Ma'am,
that's
just because our college is a women's college, and can you just explain how, I mean, women are affected by this AIDS,
Madam,
and
you are not
what
audible, madam, actually.
ma'am,
Yes,
now
please,
am I
Solna.
audible, ma'am?
Yes, sir.
Now am I audible, ma'am?
Yes.
Ma'am, ours is a women's college. Can you just tell what awareness as
Yes,
students,
madam,
as
I'm
women?
coming. The next is time is
Okay,
coming. We are coming, madam. Yes.
okay.
Actually, there is a symbol called red ribbon symbol. It is a symbol of awareness for the disease entity known as AIDS and HIV. It is to create the awareness among the people and to increase the morality of the people suffering from AIDS. So that is called a red ribbon symbol. Then comes the stages of infection. Actually, I'll let you know, madam, a few things. what are the stages of infection is acute HIV infection. It happens between 2 to 3 weeks after infection, where the patient will get all flu-like syndrome like fever, lymph node enlargement. Lymph node means the neri katradunu solvaanga. So fever, sore throat, body pain, myalgia, and all those things people will get in 2 to 3 weeks, and most of the people will be symptomless. And second thing is the chronic phase, where it lasts for 2 to 8 years, and it is there is a low infectivity rate, as well as the proliferation of the production of the virus will also be low, as well as the infectivity also will be low. But during this time, the CD4 cell count will be coming down. Third stage is the AIDS stage, you all know. Okay. So how does the HIV spread? That is what you want to know. Yes. So how does the HIV spread? By having unprotected sex, first thing. Then by receiving HIV infected blood or blood products. Third thing is by using unsterilized needles, syringes, and lancets. And fourth is from HIV infected mother to the baby. It is called vertical transmission. So can HIV and AIDS be cured? No. HIV and AIDS cannot be cured. That is why prevention is so important. So are the timely medical treatment for the patient who are infected. Everyone gets themselves tested for HIV to get timely antiretroviral therapy. If you are suspected, if a person is suspected to have got the infection somewhere, I mean, if you are suspecting that I have got this infection, I don't know. So you can anywhere else, you can anywhere in the in our country, you can test for HIV. It's a very simple card test, so that you can easily get tested. So since it cannot be cured, the virus cannot be eliminated from the body, what shall we do? Prevention is better than cure, since there is no cure for the disease. So how to prevent? How can I avoid getting HIV infection? First of all, by having first thing, where how does it spread means by having unprotected sex. So you can avoid having sex, abstain from the casual sex. Actually, for the public, I'm telling, they should abstain from the casual sex, and one should be faithful for the partner. So it is called oruvanukku orthi. So everybody should use condom when they are having a casual sex, and it's everywhere. It is available in the government facilities, in wherever the I mean, our all antenatal mothers are going to know. There are all every government health facilities. These condoms are available as Nirodhs, and in every chemical shops and general stores it is available. So only thing that people have to check for the expiry date and should use it correctly. So it has got very should not get infected with for a few minutes of pleasure. A person should not get infected without using a condom. So condom not alone prevents from HIV, it also prevents from the other reproductive infections, as well as from sexually transmitted diseases, and also it protects from the unwanted pregnancy. So second mode of transmission is by receiving HIV infected blood and blood products. So always ensure the blood is from a licensed blood bank. When you are in a hospital, you are asked to get blood, means you have to get a blood from the licensed blood bank, or you have to get any family member is one can give from get from a family member. You know about our family member, they may not be getting infected from the HIV or any sexually transmitted disease, so that blood can be used. And whenever you are getting a blood from other areas, you have to ensure every blood bag carries the sticker of mandated testing for transfusion transmitted infections, including HIV. So it should bore a sticker of not tested for the HIV or other transmittable infections like hepatitis B, hepatitis C. These are all jaundice producing viruses. Okay, so you have to ensure that they have the stickers of tested for the transmitted infections, as well as they should you should get it from a blood bank, licensed blood bank. That is more important. So third thing is where we are getting the third way of getting the infection is by using the unsterilized needles, syringes, and lancets, and as well as in the IV drug abusers. So you can avoid HIV by using a disposable needle, sterilized needle, and syringes. and you should never get indulged in taking drugs, especially IV drugs. Avoid injecting IV drugs and do not use the already used needles and syringes. Very bad, very dangerous. So one has to be responsible for disposing the syringes after using it. Actually, disposal of syringes and needles is a doctor's work or nurse's work, though it is not yours. We see to that it is destroyed after using, after the usage of the injection. Okay, so you can ensure, because all the public are responsible for this, these things. And fourth is, how does a person getting infected is, fourth is HIV infected mother transmits the virus to the baby. So you nowadays we test all the antenatal mothers who have become pregnant. So first month itself, when they come to the hospital, we do HIV infection antibody test so that we can start them on triple deck therapy lifelong, so that the virus load is coming down, so it is not transmitted to the baby. And already I have showed the statistics. There is 47% decrease in the children affected with the mother born to the mothers of the HIV persons not affected with the HIV. So it is mandatory. Now it is mandatory to do HIV infection and hepatitis B infection, whether the patient is suffering from that, in the all the antenatal women, all the mother who are getting pregnant at the first month itself, they are doing the test to avoid the transmission. So next comes, do the sexually transmitted infections increase the risk of HIV? Definitely yes. The answer is yes. So sexually transmitted infections and reproductive tract infections increase the vulnerability to HIV to enter the thing, because the biological makeup of the female genital tract is like that, so that it increases the vulnerability of the HIV to enter into these things, because after delivery they have more the anatomy of the vagina and everything changes a little bit, and there will be ulcers, and there will be a breach in the vaginal mucosa. So it enhances the vulnerability for the HIV to enter into the tissue more than tenfold. So presence of such infections, especially the other sexually transmitted diseases, you may not be aware of it. I'm telling the name: gonorrhea and syphilis. You may be aware of it. Chlamydia. These infections produces multiple ulcers in the vaginal area. So whenever there is an ulcer, this HIV infection will go easily enter into the normal mucosa. It cannot enter. The HIV cannot enter. But if there is ulcer, it is easily go and attack the person, or it easily attacks gets into the person. And so whenever there is a person suffering from sexually transmitted disease or reproductive tract infection, they have to be treated promptly. So always go to the registered medical practitioner. Do not go to the quacks. Definitely, please do not go to the quacks. Go to the registered medical practitioner, so that they give antibiotics to control the infection, so that the genital tract is normal. So the fourth thing is, always practice safe sex. And again I'm telling you, it is very important. And ensure correct and consistent use of condoms, so that all the reproductive tract infections, sexually transmitted diseases, unwanted pregnancy, HIV will not happen. So what is safe sex? Safe sex is practices that reduce the risk of getting or transmitting an infection during sexual intercourse. This is called safe sex practices. So especially the primary method to prevent the spread of infections, especially HIV infection during sex, is by using the correct and consistent use of condom. That is called safe sex. And so what are the ways which it is not the HIV is not transmitted? Is by mosquito bite it is not transmitted, by sharing dishes, and by giving a deep kiss, and by the saliva, by tears, sweat, and by shaking hands, by through air, like coronavirus through air it is not transmitted, by sharing toilets, by sharing razors it is not transmitted, even by hugging, sharing rooms it is not transmitted. Only by unsafe sex, unsafe using of the IV drugs, uh, these ways only this is transmitted. Otherwise, these people are nowadays, we do not call them as HIV patients or AIDS patients. Those people are like living with HIV, people living with HIV or PLHA patients. So it is not transmitted through this way. So again, the prevention is better than cure. So how to, so if a person is infected, what to do? So patient will go in for depression. So they have to be tackled properly. So it is very easy nowadays. Before and all, actually, I want to time travel for a few minutes. Actually, in 1981 only, the virus was identified. Um, 1981, the patient was HIV virus infected people were identified in America. Actually, what happened was mm, actually AIDS was first identified in 1981 in American country, where the people were previously healthy persons who become sick. That is the word, previously healthy person. You can write it in capital letters. Previously healthy person becomes sick. So they present with abnormal presentation of the multiple, that is, in America, tuberculosis is not at all seen, but they presented with tuberculosis. So the flu virus, usually we get flu, headache, and a common cold, but it presents with florid, uh, uh, florid presentation in the chest, and the patient developed progressive pneumonia and died. So that is the presentation initially. It was then identified in the homosexual men, and it was seen in the patients of the male persons, the partners of the female persons, as well as the injectable, the IV drug abusers, and the patients who received blood transfusions, and patients are hemophiliacs. Hemophiliacs, or are the patients who receive often blood because of that is a one congenital condition. I don't want to indulge into it. These are all the patients presented with abnormal thing in 1981, and among the female patient, sexual partners of the male AIDS person. This presentation was present among the babies born to these AIDS mothers. These babies also presented with this AIDS syndrome. And in 1983, the virus was isolated. 1985, the famous ELISA test was identified, so that we can see whether the antibodies are for the AIDS virus. Then in 1982, the AIDS word was coined. From 1988 onwards, the word first, December 1st was identified as World AIDS Day. So this was the history, brief history of this thing. And so how to prevent? Actually, first we how to diagnosis by, before and all we used to do ELISA test followed by Western blot test. So many tests were present. Nowadays it is not like that. So it is very simple. A cord test, you can get it anywhere. One cord test, it show like a pregnancy. It shows two lines, says it is positive. One line is negative. That's it. And to confirm it, we are doing one more test called fourth generation antigen antibody assay. Whether in that assay antigen is present or antibody is present. Normally, when a when a virus gets into the body, the CD4 cells produces antibodies. Antibodies, that is what we identified in the ELISA test. So if antibody is present, it says the person is immune system is good. He is producing antibodies against the virus, and they will look for the P24 antigen. That is, there are so many antigens in the HIV. If there is facility to share the PPT, I would have shown the virus, but it's not possible. So there are so many antigens present in the virus, which produces antibodies accordingly, and we identify such things and see. So nowadays we diagnose with the help of the fourth generation antigen antibody assay. Suppose if it is present, so it is said the patient is infected. Then we have to see how many CD cells are present. CD cells are normally about 1600 cells are present normally. Suppose it is reduced to 500, 400, then the patient is suffering from AIDS. If it is going below 100, it is definitely the patient is having AIDS. So we will do the CD4 count also. Then we'll do the RNA copies. How many copies are present in the blood? Accordingly, we treat the patients. There are 30 different drugs are present to tackle the virus. So nowadays we have a virus which antiretroviral therapy for this HIV virus and AIDS patients, so that they can live as long as other patients live. So how do we prevent this disease? So if we have diagnosed that the patient is having HIV, so how do we prevent it? See, So early, when you identify the person is having viral load and as well as the reduced CD4 count, early antiretroviral therapy should be started. So always tell the male and female patients to use condom always, and early detection and prevention by testing and counseling the HIV patients and sexually transmitted diseases patient is very, very important. So there are many programs for the IV abusers to reduce the um, people who are injected themselves with the drugs, and we are counseling them not to do that. We are counseling them to come out of the drug, come out of the drug intake. And very importantly, elimination of the mother to child transmission by early ART. As I said earlier, all the antenatal mothers are screened for HIV, and we do give antiretroviral therapy for lifelong so that the baby is not affected. So very important thing is for the healthcare workers, what is post-exposure prophylaxis? Accidentally, if they struck with a needle or something, or they contact with the HIV tested blood, HIV positive blood, what to do? We give post-exposure prophylaxis, that is 3-drug regimen for the patients who are struck with, accidentally got the infection for 4 months continuously. They should not stop in between. And we'll do again the HIV test after 6 weeks, after 2 months, and after 6 months. If it is negative, it is negative. People are not got the HIV infection. So one more thing is yeah. So actually, what is the treatment of the HIV? It's not very difficult. It's impossible to eradicate the virus from the body. Actually, once it is entered into the cell, it is present in the cell. Why it is so? The RNA virus, I already saw the virus is a RNA virus. The gene particle is a RNA particle. It is called reverse transcriptase. Abdina, it has the ability to convert it into a DNA molecule and gets incorporated into our cells. So our cells also getting infected, which is not able to eradicate from the cells. That is the reason once a person is infected, is always infected. But only thing, by giving tablets, we can reduce the viral load, as well as when you start with the patient with the antiretroviral therapy, the viral load will go down so that the CD cell count will increase, and so that the immunity system is properly maintained. So this is the treatment. There are so many treatment. I don't want to go into that. And the Tamil Nadu State AIDS Control Society, that is called TANSAC, and NACO, they give drugs free of cost for lifelong for these patients. It is called multi-drug therapy or கூட்டு மருந்து கூடுதல் ஆற்றல் அப்படின்னு சொல்றாங்க. It is 3 drugs, tenofovir, lamivudine, and dolutegravir. These 3 drugs are given lifelong for the patients, and so that it is free of cost from the government of Tamil Nadu. So that the patient, without money, patient may not take tablets. It is not so in our country. So even now we are there is a new scheme called Makkali Thedi Marthuvam. Through this, they are giving the tablets, going to the house and deliver the tablet, so that patient may not miss even a 1-day pill. It is a 1-day pill, daily 1 pill for lifelong. So what is the hope of the disease cure? Actually, there is no cure for HIV. It cannot be eliminated from the body. So from 2005 itself, the deaths of the AIDS patient are 50% reduced from 2005 itself. So more than 50% of the people with HIV have access to treatment nowadays. So if treatment started on time, the person has the life expectancy as compared to the non-infected individual. They live as long as the other person, the normal person. So 50 years, the person will live for 50 years. So medicines are affordable and provided free of cost in the government of India. So AIDS is not forever, but it can be reduced. So there is a slogan in 2022 on it is about the equalizing. It said equalize, that is access to the essential drugs for all the persons, children, or the key population, or like the HIV patients and their partners, and the persons, homosexuals, men who have sex with men, and the transgender people, and who are the persons who are using drugs, and people in persons, they are having the access to get the drugs. That is called equalization. So equality is a slogan, it's a call to action to needed to address the inequalities among the people, to help the people who are suffering with the AIDS, and to end AIDS by 2030. They have given the slogan equalize, so that all the people are considered as equal. Those patients should not be called as HIV or AIDS patient. They should be called as people living with HIV. So likewise, if a person is affected with hypertension, say a person is affected with BP, a person is suffering from diabetes, they have to take lifelong treatment till their death. Likewise, these people also have to take the drugs lifelong. If without break, if they take the drugs lifelong, they can live their life expectancies as compared to a non-infected individual. They can live as long as the other normal person can live. So this is about the AIDS. So anything you want to ask? So we do not have treatment for AIDS, but we do have treatment for HIV. That is antiretroviral therapy. And the important thing, I hope you understand Tamil. That is, we have Tirukural about this thing. It's a ஒழுக்கத்தின் எய்துவர் மேன்மை, இழுக்கத்தின் எய்துவர் எய்தா பழி. And one more thing is, நன்றிக்கு வித்தாகும் நல்லொழுக்கம், தீயொழுக்கம் என்றும் இடும்பை தரும். So good conduct is a seed of virtue, and bad conduct brings endless distress. As well as good behavior brings greatness, bad behavior affects our dignity. That's what it says. So hopefully we end AIDS or HIV in 2030 if the patients are living properly. That's what I want to say. And about the basic gynecological welfare, actually if you ask questions, I can answer that for the gynecological welfare, or what do you want me to say? I don't understand actually. Dr. Swarna?
Ma'am, good afternoon, Kalaiselvi ma'am. Ma'am, we have, ma'am, are you audible? I mean, am I audible to you, ma'am?
Very faintly audible.
Ma'am, all our students have stomach pain, ma'am. During periods, many of our students have high stomach pain.
Yeah.
That is a basic problem we are facing with. So how to tackle that, ma'am?
I'll let you know about that. Actually, when I will show one this thing picture of the uterus. Are you able to see?
Yes, ma'am. Yes, ma'am. Very much. Yes, ma'am. Yes.
This is a uterus. This is the inner lining, and this is the cervix. Cervix is the mouth of the uterus, and this is vagina. This is called tubes, and this is our ovaries, two sides. Okay.
Yes, ma'am. Yes.
So why we are getting this dysmenorrhea? So first of all, I would like to talk about a few minutes about the menstrual cycle. Say a person is getting every 30 days menstruation. It starts with we'll think again. December 1 it starts. Let's assume like that. So first 5 days person will be having bleeding. Followed that it stops. There will be some white discharge. On the 14th day they will be having severe mucoid white discharge or watery white discharge, during which time the ovulation happens. Then the white discharge is becoming thicker, and after 28 days again the person will get periods. So the uterus has a tendency to push whatever is inside, baby, whether it is a baby or it is something, or the inner wall, that is called endometrium. The inner wall is called endometrium, where everything, whatever it is a tendency to push it out. So the unmarried women have very small cervical hole. Through that, the uterus has to push all the things. Okay, so it contracts very violently. That produces the stomach pain. That is the reason behind stomach pain. It is called dysmenorrhea. And about the tips to maintain vaginal health, I want to say something. Always use plain and unperfumed soap, and always do some pelvic exercises. Use clean underpants, and importantly, eat healthy and balanced diet, so that you will not have this whatever you are telling, no, abdominal pain, stomach pain, all those things we will not have. So next question, please.
was the main question for us, ma'am, because every now and
Hello?
then, every day, ma'am, every day we have students. Every day we have
Every day
students
you have
in,
stomach pain.
no, no, not every
Actually,
day.
can you
Every
type
day
the
we,
question here?
no, ma'am, every day we have students in, I mean, we go to 3 or 4 classes. Every day, ma'am, I go to, every day
No,
I
your
have
voice is
students.
very, very, very low. Actually, your voice is very low. Can you
Ma'am,
type the
am I
question?
audible now? Am I audible now?
No, no, no.
Ma'am,
Can you
what the
type the question?
Yes, ma'am.
Since she's typing the question, I want to tell all the students, I mean, girl students, I mean, you're at the time of getting married. In our society, the premarital sex is not much prevalent. So, it is better to take a Cervarix, an injection, vaccination against human papilloma virus, so that you will not have cervical cancer in the future. So, all of you have to take 3 doses of actually what the guideline says is when the person becomes sexually active, before that one person has to take the cervarix injection. But in our society it is not happening, so only after marriage we have the we indulge into the sexual activity. So before marriage, go and get 3 injections, 0, 1 and 6. 6 month 3 injections you have to get, so that you will be protected from the human papilloma virus, and that so that in future persons may not get cervical cancer in the cervix. So this is one advice I want to give for all the persons. And second thing is, Dr. Sonna, have you typed?
No, yes, ma'am, I have typed. Every day we get students complaining about the stomach pain. That's all, ma'am. That's why I particularly asked the question of stomach pain, ma'am. That's it.
So this usually all the people, the perception of the stomach pain will be different depending upon the person. One person may be having very severe stomach pain. One person may be having very less stomach pain. It is called dysmenorrhea in the gynecological word. So before marriage, that is before, actually the cervical opening is very small, so that the person is all the pre-married the students or children below before getting married, they will have pain. Once they become pregnant, the cervical opening is becoming larger, so they will not experience much pain after marriage or after delivery. That's the answer. It is because of the violent contraction of the uterus to push out the blood uh, inside the uterus. And I think you will be asking one more question about the important question about the PCOD. PCOD.
Yes, ma'am. PCOD.
Dr. Swarna?
Yes, ma'am. Yes, ma'am. Please tell us about PCOD also. Yes, ma'am. Yes.
Yeah, PCOD is a condition nowadays we often see such cases. Before and all, we never used to see such cases because of the alteration in our lifestyle. We are not doing much exercise, not doing walking, car இறங்கிடுறோம். So we are using 2 wheelers, so not much of exercise, and eating uh, uh, things which is having much calories like pizza, burger, more of carbohydrates with more of fat, everything, and we are not spending the calories, so that it's everything gets accumulated in the body, and they produces polycystic ovarian disease. It is otherwise called metabolic syndrome or X syndrome, where the person may become very obese with um, increased amount of insulin in their body, as well as they become a diabetic later, increased BP and PCOD, where the patient may not get bleeding periods for 6 months, followed by continuous bleeding lasting for 1 or 2 months. This is the scenario the patient's presents with. That is called polycystic ovarian disease. Actually, what happens is after periods, multiple, so many follicles from the ovary. I'll show you the picture, this thing, like this. Many many follicles will arise like this. So many follicles, only one will become mature. Only one will become matured. See, this is picture I'll show you. This is the normal thing. It's not clear, I think. It's not clear. So normally, many follicles will grow, but only one will succeed in growing bigger and forming a ovum. So on the 14th day of the period, the ovum will come out so that if the person is married, if the semen, if a sperm is getting inserted into the ovum, that produces a baby. So that after 15th day, it goes into the uterus and forms a baby. So the patient will not have periods. This is the normal cycle. But normally what happens on the 14th day, when the ovum is coming out, it waits for 1 day, whether it is getting pregnant or not. If it is not so, it dissolves itself. So that the bed formed by the uterus comes out as a bleeding on the 30th day. Okay. So this is what is happening normally. But in case of PCOD, all the follicles become mature, all the follicles become big, but nothing is matured. So the one follicle which should become a mature follicle is not happening. So the patient is waiting. When there is a mature follicle, what shall I do? What shall I do? One particular after 2 to 3 months, it is not happening. So no longer the uterus carries this bed, it is shed off for lasting for 1 or 2 months. So PCOD is a condition where you can uh, uh, covered from the age of 10 itself. You should not, you should have physical activities. You should run, you should play in the schools and everything. You should get into habit of doing some exercise or the other, and should take more of vegetables and fruits rather than taking this junk foods, and always do some exercise. That's the thing. And be, don't be fat. I mean, I don't want people to go in for zero size, but at least you should maintain a thin figure initially. If you become fat, this PCOD is a problem, and in future you'll become a diabetic and hypertensive. You have to take lifelong treatment, which is very bad actually. So that is PCOD, simple, in a simple manner. There is a big book called on PCOD, which I cannot explain in this forum. Yes.
Thank you, Kalaiselvi ma'am. Thank you so much for this wonderful information-packed session. Thank you so much,
Yeah.
ma'am. Now I
Yeah,
call.
before finishing, I want to say one more thing about
Yes, ma'am.
the self breast exam and breast screening, cancer screening.
Yes,
Kindly,
ma'am.
every month, all the students, all the ladies, kindly examine our breast for any lumps or any swellings, so that immediately come to the hospital so that we can do a mammogram and prevent the cancer. Yeah, thank you. So,
Thank you so much, Kalaiselvi ma'am, for this wonderful information-packed session. Thank you so much. And now I call Ms. Sonal Chopra of 3rd BBA for the vote of thanks.
thank you, Dr. Swarna, for giving me this opportunity. I should thank your college also for giving me this opportunity to give a talk on this thing.
Thank you so much, ma'am. Thank you so much. It's our pleasure to have you, ma'am.
Yes. Thank you.
So first
What
of
shall
all,
I?
I would thank the Almighty for making this webinar a successful event. I thank our Honorable Secretary Sir and Principal Ma'am for giving this wonderful opportunity. I thank Dr. S. Kalaiselvi Ma'am for your wonderful and valuable session. I thank all faculty members and students who are the part of the webinar. Thank you so much.
Okay. Thank you.
Thank you, ma'am.